Michelle speaking.
Hi Michelle, it's Stephen Smith here. I'm the dietitian from the Community Health Centre. Now, I have your food diary here for the past 7 days, and thanks for emailing that through. It's given me a really good idea of your eating patterns over the last week. Have you found it useful in identifying any other changes you can make?
Yes, actually, it's been really good having the food diary, but no, I can't think of any other changes I could make.
Something I would like to discuss with you today is lowering the amount of salt in your diet. Does that sound okay?
Yes, it does.
So, do you know how salt affects your blood pressure?
No, I don't think so.
Let's have a chat about that. Look, I don't know about you, but I need to write instructions down, otherwise I forget. If you need to grab a pen and paper, I can wait. What works best for you?
I know. Yes, that's a good idea. I'll just grab a pen. I've just got one here, so I can write some things down. Thanks for that.
Great. First of all, it's important to know that eating a diet high in salt can lead to an increase in blood pressure. So, salt attracts fluid, and the more fluid in blood vessels, the higher the pressure. So, think of a hose that's been turned up all the way. The hose doesn't get bigger, but there's more water and therefore more pressure. And so the heart has to work really hard to pump the blood around the body against that extra pressure. Having more than a teaspoon of salt per day can raise your blood pressure and increase your risk of heart disease and stroke. Just to be sure that I've explained everything correctly, in your own words, can you tell me why it's important to watch the amount of salt that we eat?
Well, you've said that high salt can attract fluid in the blood vessels, and that increases pressure, and that would make my heart work faster, or and it could cause stroke or heart disease.
Yep, that's great, Michelle. Now, before we go further, what do you know about salt in your food?
Well, not a lot really, but I do know that salt doesn't just come from the salt shaker on the table. It comes from all sorts of foods.
Yep, that's right. And actually, 80% of the salt in our diets comes from packaged foods. And rather sneakily, the salt's listed on the food labels as sodium.
Right.
Now, I have some tips for you to help reduce the amount of salt that you're eating. I can see here from your food diary that you like to add salt to most of your meals. Is that right?
Yes, I do. I find that my food's pretty bland without it.
Yep, definitely. And look, it can take some adjusting, sometimes up to even 6 weeks to adapt to having less salt in our food.
Mm,
One of the easiest ways to cut back on salt intake is to avoid using salt in cooking and at the table. So you can use things like lemon juice, garlic, herbs and spices to add a bit of flavour to your food instead of salt.
right.
Could you give that a try, do you reckon?
Yeah, absolutely. I could. Yes, I'll certainly give it a try.
And I can also see that you like to eat a lot of fresh foods like fruit and veggies, and that's really great. It's one of the best ways to reduce the amount of salt in your diet. However, looking at your food diary, you also enjoy cured meats like salami and ham. And it's important to know that preserved meats and cured meats also contribute a lot to the salt in your diet. So you should try and avoid these.
Okay.
Just to check I've explained everything clearly, in your own words, what are some of the changes you could make to reduce the amount of salt in your diet?
Well, I could take the salt off the table, and perhaps not add salt to my cooking. And yeah, cutting out those cured meats, the salami and ham would be good.
Excellent. And another tip is to go for low salt versions of sauces, stocks, and canned foods. Would it be helpful if I emailed you a fact check with some more tips to reduce your salt intake?
Well, that'd be fabulous. Yes, please.
Now, when do you think you might be able to try some of the things that we've spoken about today?
Well, I might start over the next few days. I'm going off to do my shopping tomorrow, so I could definitely be thinking about things at the supermarket.
Excellent. And Michelle, do you have any questions at all about anything that we've gone through?
No, I don't think so. Thanks, Steve. No.
All right, no worries. Well, if you do think of anything, just jot them down and give me a ring and I can answer them for you. Do you have our community centre number handy?
Yes, I do. I do. Thanks.
Excellent, great. Well, that's easy. And just so you know, we will be in touch for a follow-up appointment. All right, we'll take good care then.
Okay. Thanks, Steve. See you.
No worries, bye.